And thank you to everybody who has come out today. I'm Helen Valier, and I am a professor at the University of Houston. And I teach in the Honors College. This is our undergraduate interdisciplinary college at the University of Houston. And I also have a joint appointment at our new College of Medicine in the Department of Health Systems and Population Health Sciences. I'm not currently in Houston. I'm currently out in my in-laws farm in West Texas. And so this is why I have this array behind me. But this is, you know, a good time to have connectivity, right? We have internet everywhere, and I'm very glad to be joining you today, wherever you are. So the topic then for today is to be thinking about pandemics in historical perspective. And I, as a my primary training is in the history and philosophy of medicine. So I started off my life, as many historians of medicine do, thinking I'd go into either medicine myself or into graduate school in biology. And I was on that latter track. And then I started getting more and more interested in questions about science, right? And so digging more into the history of science and the role of science and medicine in shaping the modern world. And I ended up completely, falling off the biology graduate school route and went into the history and philosophy of medicine instead. And so that's now what I do. So at the University of Houston, my primary job in the Honors College is to run our health humanities program. And so that program is called Medicine and Society with an ampersand. And so that's really the basis of pretty much everything I do in terms of my teaching and research and public lecturing life. And that's certainly the approach I'm going to take today in talking to you all about pandemics in historical perspective, because as I'll be talking about, the history of disease is both biological and social. Right, that we can think about, diseases certainly as sort of discrete pathogens, right? That they exist as, say, bacteria or fungus, or as viruses, but they are interacting with us, and we are interacting with them, and we are both shaping each other. Right, and the ways in which we live and live in the world and change our natural environment also changes the nature of diseases, and nature of diseases in turn changes the way in which we live in the world. Okay, so it's not just so medicine society is not just an ampersand; it's kind of like a sort of two-way arrow, right? A reciprocating relationship. So that's as I said, what I've done now for over 20 years, I think, and I do my writing and research on obviously specific areas within that, and I've written on history of cancer in particular and clinical trials, and I'm also, given current events, also very interested in talking about infectious diseases in history. So I'll get a move on. All right. So then the idea then of the lecture today, and just this one standalone lecture, is really to do three things in explaining, exploring, and recognizing, right? And using history to think about diseases in these three ways. So the first thing really I want to lay out is why there are these, excuse me, explosive outbreaks of infectious diseases, why they occur in history, when they occurred in history, and why didn't they always occur, right? Because that's really the kind of, the first big takeaway point from today, if you like, is that, like Homo sapiens have been around for a really long time, but, big epidemic, pandemic disease outbreaks are actually quite recent in terms of things that have happened to us in the whole story of human history. So again, that goes back to this idea of the medicine and society, the social and the biological together, right? It's not that these diseases are some of them are new, but not all of them are. And so why is it that we've had certain historical periods be so important in terms of historical disease outbreaks. So explain a little bit about that. I'd also then like to kind of get into the analysis side of it more, and certainly would welcome ideas and pushback and questions about that, and sort of exploring some of the common themes that we see in public health responses. And something that I've been working on quite a bit of late, and certainly doing interviews and media about as well, is thinking about public responses to public health measures, right? And some of the ways in which history and historical instances of disease outbreaks can kind of give us some clues as to how we behave, right? How we behave as social animals, as sort of political creatures, as biological entities, when we're faced with not just major disease outbreaks, but also external rules and laws that restrict movement and force us to wear masks and then vaccinations and things like that. And so, what historical instances, what lessons might there be from that? So I'll pick on two main things. One being the Black Death in the 14th century, and the other being the Spanish flu outbreak of 1918. And I'll talk about that latter in much more detail. So the third aspect then is to recognize always the role of history in understanding our present condition, our present complaints, our present opportunities, if you like, and what lessons that there might be for the future and for planning the future. And so again, I think that history is an incredibly powerful way to understanding the human condition, and I think that we shouldn't be too shy in thinking about how we can better prepare for the future. Not because, as I'll be talking about a bit later, not because history necessarily repeats itself, because context is important. Attitudes and technologies and things change between different time periods. Of course they do. But there are certain recurring themes perhaps that we can take note of that will just help us to know in advance, right? Forewarned is forearmed, and be thinking and planning for in the future. And that's already happened. I mean, this does happen already, but just to kind of, get that message out a little bit further. And again, this is an argument I'm making, and you're welcome to argue back with me, and I hope that you will in the Q&A. Okay, so a note then on a few terms. You're probably, I would imagine many of you much more familiar with these terms perhaps than you were a year ago, but just to briefly explain that as is the case for a lot of terms in medicine and in science, these are relatively newly coined terms in the 19th and 20th century, but they are portmanteau, they are sort of smooshed together words from Greek and Latin. And so this is what we have in the case of some of the sort of basic terminology of epidemiology and infectious disease study. So we have a discussion of endemic diseases, and that being from the Greek en, or in or within, and demos, which is from the Greek meaning the people. So that's so endemic diseases. And so, we have endemic diseases, examples of endemic diseases now that are communicable between people. So, common cold would be a good example of that, right? Adenovirus. Epidemic, so the Greek epi, on or upon. So epidemos, so upon the people, right? So not sort of within, a contained population, but this idea of being kind of, broadcast upon the people. And then, of course, we have pandemic from Greek pan, meaning all. And so the distinctions, actually, again, this is not something that I would imagine that most of you who didn't do this for a living really would know anything about like a year ago. But, you know, I wouldn't be surprised if quite a few of you do know that there is now, you know, tension over whether and when to say that this is no longer an epidemic, this is now a pandemic, right? Because if we think back to these discussions with the World Health Organization declaring the pandemic and what stage we were at the pandemic. And that would be, you know, probably, let's see, you know, about 10 months ago now. And there is, you know, controversy. And that's one thing that I would, you know, sort of say in advance, that when we're trying to distinguish disease outbreaks, and when those disease outbreaks become an epidemic and they're labeled that way, and when they become pandemic, that these labels are not just about numbers. They're not sort of hard and fast in a lot of cases. I mean, they certainly have scientific and mathematical, quantitative and biological underpinnings, but they are, as is, you know, most science policy and public health policy, they're sort of heavily negotiated because they have enormous implications, right? And so especially if you are declaring an epidemic or a pandemic, that will then have knock-on effects to things like travel and borders and trade. And, you know, these are all like really critical considerations that make these decisions and this decision making both very, you know, very high stakes and also very contentious. And here's the thing about that, right? That this isn't new either, right? And so when you would say, if you were in, you know, 14th century Florence, and you were declaring a disease outbreak and implementing quarantines or public health measures, you know, again, this would be a very contentious thing, because here's the thing about public health, right? That's different from how we normally think about health and healthcare and medicine. We would ordinarily, I think most of us anyway, would think about health and healthcare and medicine as something that occurs on an individual level, right? It's us and our clinician, right? It's us and our nurse, it's us and our, you know, chiropractor or our, you know, physical therapist. But that's not all that health is, because our health is influenced by other people around us, it's influenced by the environment, and, you know, especially in the case of communicable disease, diseases that, you know, could be transmitted person to person, it means that the behavior of others affects our health, right? I mean, you know, and again, this is not specific to infectious diseases, because, you know, that could be true of say, you know, somebody smoking a cigarette, or perhaps somebody, you know, driving cars and that affecting pollution and ozone and things like that. So it's not like it's like unique to infectious disease study. But in the case of communicable diseases, especially diseases that are highly transmissible as coronaviruses, these kinds of things just become much more visible, right? Much more apparent, and therefore demand and grab our attention in ways that perhaps other things should, but maybe don't stay in the forefront. So the other aspect that makes this kind of a recurring theme, and that's something that you know, will come up again and again, whether you're in, you know, 14th century Florence or 21st century Houston, is this idea that, you know, because our health, our bodies, right, is so very, it's like the most personal thing possible, right? It's who we are. It's our, you know, it's our identity in many ways. And so the idea then that there is going to be an external authority about that, you know, it really presses on a nerve, right? That, you know, throughout history, like, people with authority have told people without it, you know, how they can move around in a life-threatening situation in disease outbreaks. And so again, there is going to be an inevitability about the fact that that is going to be fraught, right? That is going to be contentious. And this is kind of what I mean when I'm talking about sort of, you know, exploring these themes for kind of, you know, clues to dealing with the present and planning for the future, is that if we're not surprised, and I would strongly argue that we shouldn't be, that public health is political, right? That public health interventions, measures, whether it's masking or quarantine, is going to press on these existing stresses in society about the relationship between the individual and the state, and the limit of individual freedom and the public good, that there is nothing inherently wrong with those kinds of issues, right? But what we're going to see is that these issues play out in often very divisive and inflamed ways if we only really ever talk about that when we're actually in a crisis, right? And so if we can be a bit more kind of, stay a little bit more focused perhaps on why public health is political, because it happens in public, because it's affected by policies, by laws, and by other people's behaviors. So that makes it political, right? And not to try to sort of sanitize or shy away from that when times will, hopefully soon be getting better for all of us. I think that would be, that would definitely be a lesson that I would encourage. I also want to say something briefly about plague, because plague, as it's understood historically, can be a little bit confusing sometimes, right? Because plague, the way that historians of medicine use plague is really often as a metaphor. And that metaphor is perhaps best understood in terms of how the sort of Latin versions of the Hebrew Bible started to interpret this word. Well, they interpreted it as plaga, right? Either from the Greek or from the Latin plaga, and meaning a strike or a stroke or a wound. And from the Hebrew Bible, thinking about in the book of Exodus and the plagues on the Pharaoh. And I think that's a really good way of thinking about how plague works as metaphor, because the idea of plague, the reason why when historians talk about plague as not being a single disease, is because plague is, as a metaphor, really what we mean today when we're talking about epidemic and pandemic. It's this idea of being completely overwhelmed, right? It's this idea of the fragility, not just of your own body, as we might think about it if we ourselves became very sick, but the fragility of the public body, of the whole community is exposed and shown to be fragile, right? And so it's that sense of vulnerability, of an overwhelming strike, right? Obviously in the Hebrew Bible version, it's a strike from God against the Pharaoh, right? Against the tyranny of Egypt, but in terms of extending that metaphor to today, that's what's at stake, not just our individual body, but our public body, right? The public good and our wider social. So yes. So when if I'm talking about plague, that I'm not always talking about bubonic or pneumonic plague, right? So we've certainly had many instances of pneumonic and bubonic plague, including one of the biggest historical pandemics of the Black Death in the 14th century. I mean, this is this is primarily caused by Yersinia pestis, the fleas on the rats, and that's our sort of familiar plague story. And today, when we're talking about plague as a biological disease rather than as this more broader metaphor, that's what we're talking about, right? So here I am in West Texas. Like this is a part of the country where plague is endemic, right? So some of the gophers and things like that, the prairie dogs have plague. I mean, plague is a it's a disease that is still around and still out here, but it is an endemic disease. It occurs within wild populations, and very occasionally a human will contract it. So it's treated with antibiotics these days. It's not unless if it gets treated, it's not particularly serious. So there's plague and there's plaga plague, right? So that's basically what I'm getting at here. Okay, so this is something, I know it's a lot of words here, but I do want to get my Thucydides in a little bit. Thucydides, for those of you who are not familiar, Thucydides is along with Herodotus, who was a historian of the Persian Wars before him. Thucydides is considered to be one of the the fathers, the forefounders of the study of history, the historia or the inquiry, right? And Thucydides is a general in the Peloponnesian Wars, fought between Athens and Sparta, and their allies in the various sort of leagues of allies that they both created. And so the Plague of Athens is one of our, as much of what Thucydides wrote, because Thucydides wrote, unlike early historians, with much more sort of eyewitness accounting, right, of actual events that he was present for as a general. He also wrote plenty of things that he didn't witness and that are much more about things that he thinks should have been said or would have been said in these long speeches. But he gives us what is a pretty authentic account of the Plague of Athens. And so here we see, historians have pondered about this. It's quite a popular activity for our sort of more biologically oriented colleagues to try to figure out exactly what these diseases would have been. But oftentimes in history we're just not going to know, right? First of all, and second of all, if we think about the plague or metaphor version of plague, as opposed to like, is it typhus? Is it smallpox? Is it, that helps us then to sort of think about it. It's like, well, what does it actually mean, right? What's the impact? And the impact is completely overwhelming, right? And so therefore it qualifies as a plague. And so this is a time in the war in which, there is a sort of great deal of optimism on the side of the Athenians that they're going to win, but then there's been some setbacks with Sparta, and so the Athenians and the people in the countryside have been brought into the city. So the city is very, very crowded and very, very dense, and densely populated, and we see an outbreak of diseases. So here's what Thucydides says about that. Another misery was their dying like sheep as they became infected by caring for one another. And this brought about the greatest mortality. The present affliction was aggravated by the crowding of the country folk into the city, which was unpleasant for those who came in. They had no houses, and because they were living in shelters that were stifling in the summer, the mortality was out of control. Dead and dying lay tumbling on top of one another in the streets, and at every water fountain lay men half dead with thirst. The temples also, where they pitched their tents, were full of bodies, of those who died in them, for people grew careless of holy and profane things alike, since they were oppressed by the violence of the calamity and did not know what to do. And just so, because they sought their liver and their property were equally ephemeral, they justified seeking quick satisfaction and easy pleasures. But the pleasures of the moment, and whatever contributed to that, were set up as standards of nobility and usefulness. No one was held back in awe, either by fear of the gods or by the laws of men. Not by the gods, because men concluded it was all the same whether they worshipped or not, seeing that they all perished alike, and not by the laws, because no one expected to live till he was tried and punished for his crimes. But they thought that far greater sentence hung over their heads now, and that before this fell, they had reason to get some pleasure in life. So again, that really kind of brings up the idea of the plague, of the plague as metaphor, because it's not just about the individual suffering and the individual dying. It's about the breaking down of social bonds. It's about the breaking down of what it even means to be part of a community, right? Whether that's in common worship, in common law, in the bonds that tie us together. And I do love Thucydides, but I won't spend any longer on Thucydides, but I will just make the comment that, you know, if any of you now want to rush off and read the whole history of the Peloponnesian Wars, if you haven't already, I recommend it. Then the other instance of this where Thucydides will talk about this similar kind of breaking down of everything, right? Not just individual death, but the death of society will be in stasis or civil war. Right, and he'll talk about that. So both plague and civil war are these sort of ultimate threats, right, of annihilation of everything. And so, you know, again, the themes here that we can pick out for, you know, historical lessons for all time are really, you know, everywhere, right? I mean, this idea that for those who are being, you know, highly pro-social, right, caring for the sick, or, you know, ministering to them, you know, healthcare workers of today, that those people are very vulnerable to diseases. And unfortunately, you know, throughout history, the people who have died in greatest numbers because of infectious diseases have been healthcare providers, right? Have been or people who are caring for the sick, however we describe that. And then, you know, and then sort of similarly, the kinds of just breakdown of behaviors that we would not otherwise expect. So, you know, a very early and stark lesson there, because this is from Thucydides, who is writing in the, you know, around the 400s before the Common Era. Okay, so as I've already suggested, historically and today, epidemic disease outbreaks, so that would count as one of those, right? It's not just a few people suffering from whatever the plague of Athens was, so probably typhus. It's not just that, it's upon the demos, right? It's upon the people. So it's an epidemic disease. So, you know, those are still pretty common today. Obviously right now it's very common, but historically they've been pretty common. Pandemics have been much rarer, right? And again, you know, there is much to be said about the distinctions between epidemics and pandemics, but certainly for this talk, you know, I will just sort of highlight what the sort of three historical pandemics are considered to be by, you know, most historians and epidemiologists, but then sort of, you know, think about just a couple of those, but also to sort of just to keep reminding you that this distinction about, you know, when epidemics become pandemics is, you know, essentially a question of policy and politics as much as anything else. It's because, you know, even when an outbreak becomes an epidemic, so a disease outbreak is really something that you would expect to something that's unexpected, right? So so say you have seasonal flu, right? When you have a spike in flu, that's not epidemic flu, right? It's not even an outbreak because you expect that, right? It's part of that pattern of seasonality of when you would see cases increase and decrease. So disease outbreak becomes something that happens, like literally it breaks out of that pattern, right? It breaks out of that cycle. And so when that would shift to an epidemic rather than an isolated disease outbreak would be that, you know, it's spreading a certain rapidity, you know, it's affecting these people, they're getting sick, you know, transmitting and all of that. So again, I'm not saying that this is anything goes. I'm not saying it's arbitrary. I'm not saying that at all. But what I'm saying is that there are many factors that go into it, right? And not all of those factors are mathematical, right? They're not all sort of delineated empirically or statistically. But, you know, it involves making decisions, and those decisions are criticized and heavily criticized. And it's not, and they should be, right? They should be open to criticism and debate. But again, I think that we sort of get this sense that scientific policy making doesn't work like that, and that, you know, if we have a science-based policy, it should sort of be really clear be absolutely definitive and never change. But again, that's not in the nature of the beast, because disease spread is very unpredictable, and there's all kinds of random what we might call stochastic elements to it, and so it should change. It should have feedback. It should be responsive and nimble. But that can be very difficult to accept as a public. First of all, if we are being influenced by all these other things that I've talked about, which again, there's nothing bad in being influenced by these things. It's pretty inevitable that we're going to be under a lot of pressure when we're thinking about our individual choices versus the public good, versus like how we're going to interpret rules that are coming from political authorities, and then like all this sort of science messaging, like is it changing, is it reliable, and all of this. So again, I think that like that seems like uniquely chaotic to this particular period in our lives, because it is to our lives probably, but historically it's not, right? And I mean personally, I actually take quite a little bit of comfort in knowing that, because it ends, right? It does. It will get better. So these epidemics then have been fairly common. Pandemics are much more unusual. But the main point really I want to emphasize here is that, relatively speaking, in terms of the 150,000 years or so that Homo sapiens have been around, that these are relatively recent, right, in terms of our historical record. Now, we have an historical record, a written record that stretches back really only to the beginning of most sort of city cultures, right? And so talking about Mesopotamia, or ancient cultures in Egypt, or in the Indus Valley, or the Yellow River Valley in China. So we're talking about like 5,000 years of recorded history, and then of course this is history that like we have in our libraries, right? I mean, there's been other kinds of records that have been lost. There's been other kinds of records that were not ever collected, and so we don't know about other possible narratives about these sort of big disease outbreaks, say in much of Africa or across a lot of the global south. So there is that kind of like asterisk next to recorded history always. So the reasons though why communicable diseases and infectious diseases are rare is very much, again, to do with this sort of medicine and society thing. It's to do with the ways in which we started to change how we lived after the last ice age, which was like 10,000 years ago. So as I'm sure a lot of you know, this is sort of typically when we think about the first sort of the settling and the development of agriculture and agricultural land, and so moving from a more nomadic kind of lifestyle to actually sort of cultivating land, cultivating crops. Like why this happened, was it population density, all of those things. Many people other than me are much more qualified to have that discussion with you. But there is a change in the paleontology. I'm not going to get this right, I can tell. In the change of the bones that we dig up about our human ancestors, paleontological record, right? And so we can't see all of it. In addition to the recorded history, of course, we can kind of look at the the physical remains, the archaeological remains, and we can't see the evidence of all diseases. Diseases of soft tissues, for instance, wouldn't show up on the record of bones, of course. But we know that a lot of diseases, a lot of infectious diseases, have been around for a really long time. And so again, it's not like that they suddenly appeared. I mean, some did, but some have been around for a very, very long time. I mean, something that is also non-communicable between human beings, but is also connected to the growth of the city-state, will be something like malaria, for instance, right? So it's not all about communicable diseases either, because as people moved into areas to plant crops, they drained land, they created marshes and swampy conditions, and therefore had the mosquito population explode. So again, another ways in which you have, malaria become this sort of, like major global killer that it still is because of the ways in which human beings interacting with the land, right? And so, again, that's not even actually a particular comment about like, I shouldn't have done that, right? But it's to say that there are consequences, there are knock-on effects, and that those are very often unforeseen. Not always, but sometimes. Okay, so as I said, there are three usual kind of culprits when we think about the history of pandemics, right? And so again, the fact that there's only three, I mean, people will argue for other things, shows you just kind of how rare what's happening to us right now actually is, right? And so the three major historical pandemics have been the plague of Justinian. So this is happening, what, 800 years after the plague of Athens, in the Roman Empire. The Black Death, which most of us have heard of, obviously, in the 14th century, and the Spanish flu. So, excuse me. So the reasons and again, it's not just at the time, it's hard to say like when an epidemic becomes a pandemic. It's also, we have these arguments about looking at the historical record, right? I mean, the records that we have for the Spanish flu are obviously a lot better and better organized, more accurate than they are for the plague of Justinian. And the plague of Justinian, we only have records for that really because one of the things that the Romans did for us was keep really good bureaucracy, right? They kept very good records, and so again, it is not sort of hard and fast that there are these very, very clear differences between epidemics and pandemics. But the reason why these three are considered to be pandemics is because of how many of, or what proportion of the population was impacted, right? And how many people were infected. And so again, we see that with COVID-19 now, that it's everywhere in every continent apart from Antarctica. Excuse me. And we're sort of steadily climbing in terms of like how many, like as a percentage, how many people in the world's population have been infected. And so so for instance, the Spanish flu, our last pandemic in the early 20th century, this about a third to a half of the entire population of the world was infected. So hopefully we're not going to get there, but that's kind of the trajectory that we have, right? Similarly with the Black Death, we have just so many deaths as a percentage of the population. So there is there are more deaths obviously in Spanish flu than there are in the Black Death or in the plague of Justinian. But as a percentage of population, it's not just the deaths that we're thinking about and the geographic spread that we're thinking about with pandemics. It's also like what percentage of the total population is also infected, right? Who's affected by it? So again, making those calls is quite difficult, right? And it's open to interpretation. But this is an image, an untitled image. All of these images, by the way, are in the public domain. I've got links to the sources for all of them. This is just again a great sort of coming together of all the things I've been talking about. Here we have a 15th century image of plague. And at the bottom of the bed here, we have a physician. We can tell he is either a physician or an apothecary, a kind of early pharmacist, by his clothing, and also by the fact he's holding up a flask, and that flask would have been full of the patient's urine. And so he's doing urinalysis there of looking for color and any clouding, any clumping, consistency, and also again, for those of you who are pharmacists, probably quite happy that we don't have this anymore, but also would have tasted it as well to see whether it was salty or sour or sweet. Here we have it looks like a woman in religious orders, praying at the bedside, and just sort of slightly out of the image, cropped out the image there is the family, and here we have this horrible image of death, and the arrow of death piercing the patient. And so again, we have the kind of the individual suffering, the social event, the religious anguish, and the medical helplessness in the face of this overwhelming plague, or this overwhelming blow, in which death appears to have the final stab there. So the plague of Justinian and the Black Death then have these sort of enormous geographic spreads within a relatively short period of time, right? And so this is why again, they are sort of classified as being like an event, right? And that event, because of the very rapid spread, because of the very, very widespread transmission, are sort of labeled as pandemics. But if we just focused on those things and ignored epidemics, right, ignored the kind of not necessarily global, not necessarily fast outbreaks, we'd really miss the importance of infectious disease in shaping history. Because what in fact we have is between between the Black Death and up until the 18th century and into the 19th century is what we call an era of epidemics, right? We have these epidemics that recur and recur and recur and recur. And the thing about the era of epidemics is that the onset and when they start to tail off, that they are as deadly as they ever were. Right, so it is this sort of historical peculiarity that we're just seeing devastating death every time something breaks out. And so I want to just spend a little bit of time now kind of explaining some of the biological reasons for that, and I promise I'll try not to get too boring. So I mentioned before that we're sort of coming into this era of agriculture, and along with that, the domestication of animals, and that's sort of happening for about, from the last ice age, about 10,000 years ago. So now it's not just draining the land and sort of generating ideal populations of mosquitoes and malaria arising from that. And it's not just sort of cultivating the soil and turning over anthrax and botulism and all these other things as well. It's the domestication of animals has been the #1 source for communicable diseases in human beings, right? So it's a process called zoonosis. So that's just zoo with osis at the end of it, right? Again, you'd be amazed at the portmanteau style word choices of 19th century scientists. So just like, let's have a word that means animals, zoo. Let's have a word that means like beginnings, osis, right? And so put the zoonosis together. So from domesticating wolves and dogs, we get canine distemper, which is measles, right? And so from cattle, and we get tuberculosis. From horses, rinderpest, another disease of cattle. We develop sort of rhinoviruses and adenoviruses, and common cold, for instance. And so on and so on. Influenza being a major one, so influenza jumps the species barrier, does that zoonotic jump between domesticated fowl, chickens, ducks, geese, and also from pigs, right, from raising pigs. And so it's that very close proximity in domestication between people and people, because people are living closer together, and also people and animals, that sort of continually throws up these zoonotic variations that will have a transmission event to human beings, and then that transmission chain is built up between human beings, and we have an infectious communicable disease. And so like literally the origins of surplus production of agriculture and animal husbandry also brought along with it infectious diseases. Now, the plague of Justinian and what will happen also in the Black Death in the in the 14th century and 1300s it also has that other aspect of the social story, because the Romans just didn't bring bureaucracies, they brought armies, right? They brought roads, they brought like incredibly impressive technologies of transportation and organization and motility. And so we take all of these things together, animal human interactions, cities and densely populated areas, and very rapid transportation, right? That you imagine, like if you're traveling along a Roman road, which sort of notoriously is straight and well maintained, and has less banditry, how quick that would be in comparison to riding a horse across country, right? So it's that very, very rapid increase in global movement, really, that this is the reason why we see for the first time outbreak of epidemic diseases upon the whole of the demos, because these isolated outbreaks have an opportunity to become embedded in populations that they would never have otherwise reached, right? So that's the story. That's the story of why civilization and infectious diseases go together, so hand in glove. Now, in terms of what's happening in this period, in the era of epidemics, well, just as the Romans brought about this revolution in transportation, so this is the beginning of the age of exploration, the age of colonialism, the age of transporting, first of all, sort of influence and gold, and then war and conquest and imperialism around the world, and so along with that then, and also the ways in which warfare and conquest kind of brutalized and weakened societies, including obviously the indigenous society in what would become the United States. That this is part of this whole global era of epidemics. So not one particular instance. I mean, there are some major instances that are named, like the Great Plague of London, for instance, that occurs in 1665. But it is just basically this sort of ongoing kind of series of disease outbreaks, of plagues. And again, the plagues sometimes would be Black Death, sometimes it would be smallpox, sometimes it would be typhus. There's just a lot of culprits that go into there, but just these cycles of death across major population areas. And here's the thing about cities, is that they're incredibly dangerous and unhealthy places to live in. And so for most of their history, cities actually are not able to sustain themselves without constant migration. And so that's like possibly one reason why, whether we're thinking about outbreaks of cholera at the beginning of the 20th century in the US, or we're thinking about, again, our Florentine, or sort of, the observer in Florence in the 13th century, that most of the people who are in the city they're not there for generations to have time to create immunity or have herd immunity, that there is just this ongoing kind of overturning of the population, that too many people die as compared to how many people survive their first 5 years of childhood. And so the city is constantly being repopulated from the outside. And so, the age of epidemics, as I said, it sort of typically is dated to the 1700s, 18th century. But, the 19th century is also a time of, very major infectious disease outbreaks, right? And so the thing I like about these two images, first of all, the sort of King Cholera image, it's from a magazine, a British magazine called Punch. And again, just that idea of the kind of squalor and the compression of sort of human beings in these big cities, and then also here on the right, the barbarity of cholera as it enters into Europe. Very, very much again, the notion of the plague as being the stroke, as being the strike against everything that makes us who we are, not just as an individual, but as a species, right? That this is just this sort of overwhelming blow. And cholera is, these diseases are all terrible, of course, but cholera in particular was terrifying because, it could kill you in a few hours. And so, we have these heartbreaking stories of people kind of leaving their home in the morning and then coming back with a message that all is not well at home by the mid-afternoon, and their wife and their children being dead. I mean, it was awful. It was just horrific. And, we're still having cholera outbreaks, throughout the late 19th century into 20th century. Similarly, smallpox. Similarly with measles. And so the era of epidemics kind of, the outbreaks start to dissipate, especially in the old world. But yeah, I mean, they still persist, and certainly as we now know, novel diseases can emerge and emerge very quickly, and with absolutely sort of, again, devastating impact on us. Okay, so this is the final part, you'll be pleased to know, of the lectures today, and just want to sort of focus a little bit on the Spanish flu. As I said, this is considered to be a pandemic by historians and by epidemiologists, because of how many people in the world were infected, right? So something like approximately, a third, perhaps more than that, of the world's population. As again, you probably know more about Spanish flu than you did a year ago. So it hits in several waves, and the second wave is particularly deadly, and that becomes relevant to something I'm going to say in a minute. So there is a loss of life that, again, people argue about. Some people put it over 100 million, some people put it under 50 million. But in any case, many more Americans will die of Spanish flu than will ever die in World War I. Okay, so this is a quote that I like. So history does not repeat, but it sometimes rhymes. Supposedly from Mark Twain, maybe not from Mark Twain, but in any case, I like it, so let's keep it. So history does not repeat, but sometimes rhymes. All right, and so this is why me and countless other people who study what the kinds of things I do, have just been phoned up every week by journalists who are kind of coming across this stuff on the internet and being like, is this real? Like, did people really say these things in 1918? It's like, yes. I mean, it is eerily close to our sort of current issues. Wash your hands, wear a mask. Don't wear a mask for yourself, wear a mask for others. Closing schools, churches, theaters, right? All of these things, we've seen play out, and we've seen play out in the US, and that was in 1918. Now, the other thing to note, see, we all need to get some Lifebuoy health soap. Maybe we should have had that as a door prize. I'll speak to the management. The public health and public health responses also very similar. This is an image here, and trying to get on a streetcar in San Francisco without wearing your mask, right? So again, if you look through newspaper archives, which you won't even need to do now because all you need to do is Google search it, and so many people have been, which is great, right? So many people have been writing about this, and sort of journalists have been doing a great job in getting these stories checked by by scientists and physicians and historians who know what they're talking about. Then getting this stuff out there. But yeah, I mean, there were anti-masking leaks, there were anti-masking leaks. I mean, people were going after people who weren't wearing masks, people who were wearing masks were going after people who weren't wearing masks, and vice versa. There were publications about how masks, if breathing in the carbon dioxide from masks caused you to get sick and get pneumonia, or so the symptom of Spanish flu that was most deadly was not necessarily even the flu itself, although that did kill a lot of people. But a lot of people also died of bacterial pneumonia after they recovered from the flu. And so a lot of leafleting and sort of campaigning around this idea that it was actually all this stuff was actually not being caused by the influenza, it's being caused by wearing masks, right? And so again, if you think about like how people have been talking about masks now on social media, who are opposed to wearing masks, it's the same kind of concerns, if you want to call them that. The same kind of doubt about the role of mask wearing. But whether we see that as sort of an interpretation, biological interpretation. Again, I spend a lot of time with working in a medical school with physicians. A very, very close friend of mine is a surgeon at the VA, and she wears a mask for sometimes 18 hours in the operating theatre, and so she has a few choice words to say about this issue. So I'm particularly thinking about her right now. But the idea again that there would be an enforced wearing of masks, and whether this was like an overreach, whether this was really needed. And this is again where this timing stuff comes in, because you have this this second wave, and the first wave hasn't been as bad as people were worried it would be. And so the thing about public health measures is that if they're successful, they are going to be criticized because they're going to be they're going to be seen as being overreaction, because if they're successful, then that means people don't die, right? And so, but sometimes people don't die because that's what happened as well. So it's again, it's always going to be controversial, right? But in the second wave, which was a lot more deadly, we do see just enormous differences. And again, this is where having better historical records comes in. Now, this is actually an image that I found that was compiled on Wikimedia Commons, and you've checked all these sources as well. But it's just particularly helpful, I think, because it's accurate and it lays things out. That what we're really seeing here is the differences in enforcement of public health measures. Right, so what we call NPIs, or non-pharmaceutical interventions. And so non-pharmaceutical interventions are washing hands, social distancing, and wearing masks, and limiting assembly. Right, so closing theatres, churches, whatever. So and again, those things have been around for a very long time. But what we're actually seeing here is the effect of different decision making at the local level, because all public health is local. right? It depends on what's going on in your community. It depends what's going on, you know, in your city or around you. That's going to influence whether or not, you know, you're going to get sickened by a transmissible disease. And so there are differences between how different cities responded. And so what we see are very major differences in mortality. And, you know, this is, it's a very, very tragic story in lots of ways. And it points to the ways in which decision making is not straightforward about these issues, right? Because, you know, what else is going on in 1918? And the reason why Philadelphia, which is in the yellow here, that has this huge spike, is because, you know, decision making was made that the Liberty Bond train was coming through, right? The Liberty Bond train is raising money for bonds after or at the end of World War I. And, you know, that's also necessary. The economy is also important, right? And so there's this huge parade in Philadelphia, and, you know, again, almost immediately people start falling sick. Within hours, people are falling sick. And then there's this huge mortality spike. And then, so, you know, it's in hindsight, it's very easy to look back and be like, oh, right? But, you know, again, remembering at the time, it wasn't particularly clear, you know, what the second wave was going to look like, if there's going to be one. And also, you know, whether or not, like, it was worth it to go and raise money for the bonds that were needed by the Treasury, right? And so we see, you know, we see Boston behaving slightly differently, St. Louis, which is, you know, usually taken to be the kind of, you know, the model here of staying in lockdown, of actually, you know, being able to come out of lockdown quicker because, you know, so many people are like, you know, we're compliant with that and so on. You know, and then we have these blips around Armistice Day. It's like, when do you say, like, this is an event significant enough to relax social distancing and assembly mandates? And so a lot of people, Armistice Day, you know, the official end of World War I, okay, and so on. So there's not only ever the disease going on, and sometimes when we're doing history, we can look back and we can kind of forget about how complex the moment is, right? Because again, right now, we're not just dealing with a pandemic, of course, right? We've just dealt with the election. We just dealt with, you know, all of what happened around the election and around, you know, declaring the Electoral College vote. And so again, it's not ever just going to be about the pandemic, right? And so, you know, I think that if we're going to learn lessons or history rhymes, is to remember that, both when we're judging the past and judging the present. Okay, just to end on a slightly lighter note, that we're now all, like, you know, dab hands at Zoom, of course, but the opportunities to sell technology to those of us who were in isolation was very much present in 1919 as well. And so the Central Union Telephone that became the Bell system, that became AT&T, was very keen to stress to people that you didn't have to be alone in quarantine, that you could be on the party line, right? You could be on the telephone. And so sort of trying to encourage people to overcome the effects of isolation by finally getting a telephone, or, you know, even just buy yourself a piano. Maybe everybody that you quarantine with doesn't want to be quarantined with you anymore, but go on, buy yourself a piano, right? So again, this whole notion of, like, building the domestic space as being a space of entertainment. Okay, so to conclude then, I think hopefully what I've done is to show you that, you know, our modern world is both the sort of architect, but also the authority over disease, right? That we cause pandemics to emerge, but, you know, we also have, you know, the means to control those things, but that our means to control those things are always going to have to be negotiated with many other competing concerns, and we're not always going to get it right, okay, either. But that the unique challenges that we face with catastrophic disease outbreak, that, you know, one thing that we can know from history is that like we survived then. I mean, you know, not to downplay the fact that so many people have died, right? And are dying right now today, and it's utterly tragic. And that, you know, in the face of this death, there is still hope for resiliency and recovery. And I really do hope that all of us can take some solidarity in the fact that the times that we're living in are interesting times, and nobody ever wants to live in interesting times, but that there is a shared human experience to be found in this, and a shared solidarity, and that we can look to it with a certain amount of humility. So that's the end of my lecture comments for today. So hopefully we have some questions.
If anyone would like to engage personally, I would be happy if you just raise your hand. I'll be happy to promote you to panelist, and you can engage with Dr. Valier in person, verbally, ask your question. It looks like there is one question in the Q&A box.
Yeah, so percentage of population. So yeah, it's a great question. And again,
go ahead and go ahead and say the question, because not everybody sees the question.
Oh, I beg your pardon. Okay, so the question from Kelly Lang is what percentage of the population were each of these pandemics and the plagues? So the you know, historical demography on those things again has a wide range because of, you know, different methods employed and so on. And so you know, I mean, don't get me wrong, it's a really interesting topic, really interesting debate, and it's frankly not my specialist area. So what I would say is that enough, right? It's enough of the population for the consensus to emerge from people who do kind of historical studies of demography, meaning, you know, the demos of the past, that even if they will not, you know, settle on a group of figures, they will say, you know, a substantial enough proportion of the world's population was affected for this to be considered to be a pandemic. And, you know, if we use the, you know, the Spanish flu, or I think sort of pretty safe in saying the Black Death as well, you know, that would be at least a third of the population affected. And so how many people are infected and, you know, survive, again, it's more difficult to say in the absence of better data. But yeah, I mean, you know, we're talking about, you know, one in three people. That's a lot. I'm just going to turn the blinds because the sun is now going down, so I don't want to be overexposed so much here. Sorry about that. Okay. So Susanna asked a question, what did the emergence of the pandemic in 1919 look like? So yeah, the pandemic, so the very early stage of the pandemic sort of starts in 1917. And to go back to Kelly's question about like, well, what percentage means a pandemic, right? What is all that about? World War I is really important to understanding why Spanish flu becomes pandemic. And again, you know, many more of you are much more likely to know about this than would do kind of a year ago, 2 years ago. But there's nothing Spanish particularly about the H1N1 influenza outbreak. It's just because Spain had an open press during World War I as a neutral country. The disease was reported in the Spanish press, and so that's why it got the name Spanish flu, because it was suppressed by the British and the French and the US, and it was because it was killing so many soldiers, right? And so, you know, there is various controversies about whether the Spanish flu started in Kansas and was taken by troops to France, or whether it was or whether the Spanish flu originated in the trenches in France and then was spread back to the US. But either way, the fact that World War I was coming to an end and that troops were traveling, and again, this is a global event. It's not just happening in Europe, between Europe and the US, because World War I is a global event, right? It's a colonial war. There are colonial troops fighting. The theaters of war are extending into colonies down East Africa, across India, and so on. This is a sort of global state of affairs. So the fact that there are railroads and fast steamships that it's possible to get on your transport well, become ill, and still be alive when you get to the other end, even if you're going to die of your illness, and therefore transmit it. So barrack hospitals, military bases became these sort of huge places of infection in the US in 1918, and that's really what first captured the imagination. But again, when people are writing about this in the media, in the press in 1918, it's not clear that it's going to be very different from other flu outbreaks, because I know, for instance, in Texas, there's a major flu outbreak in 1900, right? And so, a lot of people are writing that like, this isn't any worse. This isn't any worse than the flu, right? This Spanish flu, this isn't any worse than anything else we've seen before. So, don't pay attention to all of these people who are, encouraging you to panic, because it's not any worse. So that again, that minimizing and that worry about whether this is an overreaction, whether it's just got something to do with the troops being malnourished or exhausted, or whether this really is a novel outbreak, and whether this really is going to have a major consequence, it's not clear. And then people start to die in huge numbers, and then it becomes, unfortunately, very clear. And that's typical, again, of epidemic and pandemic outbreaks, that there will be this initial confusion, and then in the nature of things, we have just overwhelming death and hospital facilities being completely overwhelmed. And then it's like, okay, that actually was a pandemic, that actually was an epidemic. Okay, so Cheryl has a question. How long do you think COVID-19 will subside? Masks and not necessarily. Okay, yeah, so this is true, I'm not God. Yeah, but I appreciate the comment, thank you. Yeah, I mean, I am a historian, but I do work in a medical school. I do spend a lot of time talking about exactly this issue. So, with the understanding that I'm not, a PhD is in medical humanities and not in medicine. I will say that, the people I listen to most and trust the most are basically saying that, yeah, we will need to be wearing masks for a while, right? And doing the hand washing and doing the social distancing. So, it's not going to be going away anytime soon. Those aspects of our life. But one of the things that, again, we'll see what the data says when it comes out, but one of the things that I know that the family physician group that I work with in a medical school is saying is that they're seeing much less flu, right? And maybe that's got to do with the fact that we're washing our hands more and wearing masks. And so if we're saving people's lives that otherwise might have passed, particularly if our older population who are very susceptible to flu. Flu complications, then that's at least something of a silver lining. But I just they feel optimistic that we are going to be able to just be more normal in terms of our social interactions And that's really what I'm looking forward to. And, you know, if we still have to wear masks and things, then I'm okay with that. I just want to go back to work. You know, I just want to see my students. I want to be in the classroom. I'm sure a lot of people feel the same way, but, you know, thank God for the vaccine. I just feel very optimistic about that. Say a little more about the necropolitics of pandemics. Yeah. Okay, backlash. Yeah. Oh yeah. So just to take Amy and Anna's question. So Anna asks, you know, about the politics of death and necropolitics and the pandemics, and Amy asks a question about backlash against healthcare workers. Did that sort of thing happen in past pandemics? Yeah. Right. Absolutely. And, you know, we see this in past pandemics, but, you know, we also see it like in more recent past pandemics. So with, you know, Ebola, with an epidemic disease, also with the other two, because we've already had 2 coronavirus epidemics in the 21st century before COVID, right? So SARS and MERS, that happened in the very early 2000s and the early 2010s, they were both coronaviruses as well. And so they didn't become pandemic, much like Ebola won't become pandemic, because they are not as well, so Ebola is very transmissible, right? But it makes you so sick that you're unlikely to then go and transmit it to somebody else. Okay, and so with the other coronaviruses, MERS and Ebola isn't a coronavirus. It's you know, I'm just using it as an example of an epidemic that's going on until very, very recently. That link between like how transmissible something is and how and just how virulent it is, what its disease making potential is, it has to kind of hit that sweet spot biologically for it to be a sort of potential pandemic event. And that's another reason why COVID and SARS-CoV-2 happened, because, you know, because a lot of people don't die, and because a lot of people don't become seriously ill. I mean, I had COVID and I was a mild to moderate case, meaning that I didn't have pneumonia. And that was quite some mild disease. I mean, it took me months to get over it. So, you know, again, not to downplay having mild COVID, but you know, I didn't, because I got noticed that I'd been in contact with an infected person, and so isolated and then was sick. But, you know, I had the potential to infect a whole bunch of people, right? If I hadn't taken those precautions. And so that's the kind of key to that kind of pandemic spread. Now, you know, because it's very unclear often at the beginning whether or not you really are dealing with something serious, like an epidemic outbreak. And then all of a sudden this comes like crashing in because so many people are sick and so many people die all at once, that you really are. Then that fear factor, we see it over and over again. We saw it in MERS, we saw it in SARS, we see it in Ebola certainly, and we see it in history too, of this fear of the healthcare worker as maybe they're infected, maybe they are, you know, just going to make me sick if I'm anywhere near them. And so yeah, unfortunately, we've seen instances of that. I know in the UK, there's been various reports in those early days of healthcare workers not being able to go to grocery stores and being sort of banished because people didn't want to be in the same room as them in case they got sick, right? And so the reason why I'm mentioning the UK, I'm sure it happened here as well, is just that, you know, because the UK, like, it was such an outrage, like a public outrage, that like they started having these like special healthcare worker shopping days, right? Where if you were a healthcare worker, like, you know, you got to go in the store, and it was meant to be like a sign of respect. And I just thought that was very sweet, and so that's why I mentioned it. But yeah, I mean, you know, I mean, my goodness, healthcare workers are just, you know, just my heroes, because like they have been working so hard, putting themselves at risk. And just, you know, they're just getting it from all sides. And so hug your healthcare worker. That's really, you know, all I can say about that. But you know, really truly is just to try to, you know, like just meet their needs, and not, you know, I don't know, just be a little bit less critical of them, I suppose. Okay.
Okay, I think we've gotten through all of the Q&A, and Helen, great lecture. I learned a ton. So thank you. And I think we need to have you back to do the history of cancer.
Oh, absolutely. Yeah, I'm happy to do that.
That's fascinating.
I love talking about that, actually. So.
All right. Well, thank you very much for sharing your afternoon with us. And thank you everybody for attending.
No, thank you all. It was great questions. I really enjoyed it. Thank you.
All right. Well, next time we want to see you in person in the building.
Hope so.
All right. Bye, everybody. Thank you.